So everybody, thank you for joining in for another week of One Community, One Mic. We missed you all last week, but it was just a crazy week with Quest for Democracy, which was amazing. If you had the opportunity to join us, we greatly appreciate that. And our executive director, Dorsey Nunn, our host, he's having a little technical difficulties on getting going, but he'll be here in just a second. So without further ado, I'm just going to ask the panelists to please, I'm just so honored to have all you ladies here with me. Please tell us who you are and a little bit about yourself. So Asha, can we start off with you?
Sure. Thank you so much, London and Dorsey and everybody, Mark, everybody at All of Us, or Nunn, Paula. Yeah, I've been a long time advocate for prison abolition. I'm an author and a journalist.
Thank you, Asha. Rosa, welcome. Can you please tell us who you are and a little bit about yourself and things that you have going on?
Yeah, my name is Rosa Clemente. I'm an organizer, independent journalist. There's always stuff happening, so we're all doing whatever work we can do kind of in this global pandemic. But, you know, me and Asha have been comrades for a very, very long time. Our political home has been the Malcolm X grassroots movement, which I, to this day, will challenge anyone that says, well, I would put us in the history books as Malcolm X grassroots movement of really starting so much of the work that is now happening all over the country, and conversations about decarceration and abolish, and never forgetting our political prisoners. So.
Awesome. Thank you, Rosa. And without further ado, Ms. Kat.
All right. Hey, everybody. Really excited to be here. My name is Kat Brooks. I am the co-founder of the Anti-Police Terror Project, the executive director of the Justice Teams Network, and the co-host of a radio show called Upfront. I'm also an actress and a playwright, and the mother of a teenager, so somebody pray for me. My primary focus for the last decade has really been working with families who've lost loved ones to state violence, and creating systems of support and leadership development for those families.
Thank you, Kat. Beautiful. And so normally, you know, Dorsey kicks us off with the first question. And what brought this topic about is that he had a conversation with Asha, and he was explaining it to me. And, you know, I'm learning, and I believe, you know, knowledge is power. And it's we look to folks that are in this movement to bring awareness, right? And so one of the things I wanted to start off with was asking you, I'm gonna start with you, Asha, is that it's been said that many of our communities live in a state of socially engineered vulnerability in regards to the effect of COVID-19 and other ills. Can you describe what socially engineered vulnerability means for us and those in our community that may not know what that means?
Thank you for that, London. So yeah, in the conversation with Dorsey, he had used the term that most of us use, which is pre-existing conditions. And I said they're socially imposed conditions. And I'm going to ask for a little bit of breath just to talk about this, because most of us have heard the term medical apartheid. But when I think about where Black people are now, whether you're talking about higher rates of hypertension or asthma or diabetes or any of these conditions that we know create greater risk for death from COVID-19, you have to begin, as you begin with almost everything, with the original sin, which is slavery. And so I think that it's important to say at the outset, most of us who are Black have experienced this, right? The idea that we didn't get the same sort of medical treatment, for example, for pain. That goes back to the 18th century, to a British doctor named Benjamin Moseley, who believed that, well, I don't know what he believed, I know what he said, which was that Black people's skin was thicker, they could tolerate pain more. There are other doctors who would, follow him in that, consistently trying to prove the mythology of the difference between the races, which we know is a social construct. It's not a real thing. There's more differences within the Black race than there are between Black and white races, or supposedly Black and white races. But you had, for example, and he becomes important here, Samuel Cartwright, who's writing in the mid 1800s, right before the end of slavery. In 1851, he publishes a paper where he advances the idea that Black people have a lower lung capacity, about 20%. He bases this on something called a spirometer, some sort of invention that he created himself, and then just said, Black people have less lung capacity. And the only way you could get out of that was conveniently by working them harder. And so all of this was used to justify slavery. And I want to say that today, right now, when they measure lung capacity, they use a spirometer. And today, right now, as they measure it, they have to do a race correction because it is still based on that wrong information. And we see this flowing in and out throughout all sorts of areas of the medical field. But let me take a little bit more time on this. Not only did he advance that theory, he also advanced a theory of a disease of the mind called drapetomania. Drapetomania, he said, was something that Black people, a psychological condition of Black people who chose to escape slavery. But that was actually a psychological disorder. And the only way you could correct that was by beating them to death. When you think about those of us who resist right now, and you think about what happens to people who resist, it begins to make sense because you can trace it, right that line, directly back. Further, in the advent of the Emancipation Proclamation, the end of the Civil War, we watched what happened with pandemics. There was an outbreak of smallpox that had occurred within the newly sort of formed Black communities, and really tent communities, people who worked on plantations they had just been liberated from for some sort of pittance. This outbreak could have been contained because there had been an outbreak of smallpox in the Union Army. And they figured out then that you have to sort of vaccinate it and you got to quarantine it. When it happens in the Black community, even though they didn't even know what a virus was then, viruses had not yet been discovered. When it happens in the Black community, they waited. Well, could it, leak into our communities, into white communities? Do we want that to happen? And they decided what was worse was a healthy and vital Black community. This is actually what they argue, because that would disrupt the racial hierarchy. So when you think about that and you think about where we are now and you watch everything that has happened, these dual systems of medical practice that's occurred, right? The barring of Black people from medical associations. Black people are the first people to say healthcare is a human right. Black women did that. Black women doctors did that. When you think about all of the ways, and then you add to that food deserts, when you add to that projects and other places that Black people are housed that are built on toxic wastelands, and you wonder why there's asthma. When you think about all of these socially controlled factors that ensure that we will not be as healthy, we were never meant to be as healthy. That was almost written into the law. And the policies that were made to sort of disrupt that were resistant to any change. Because why? Because Southern states, as we see right now, the former Confederacy could do what it wanted. So that was the give back that the North made in negotiating with the South. They would, yes, give them money to build hospitals because Black people needed hospitals, but the Southern governors could determine where that money went. So there wasn't any kind of nationally mandated program to say, we're gonna take care of poor people here. The money went to the South and the South decided what to do with it. Does that make sense, right? Like we see that now. And finally, I'll say that what we see in for example, the Affordable Care Act, we know and can track that those states that expanded Medicaid, Black people, brown people were the primary beneficiaries of that. We saw healthcare go up, health outcomes go up for people, even though millions and millions of people do not benefit from the Affordable Care Act, millions do. And where they did, people's health was better, our health was better. Where don't we see that happening? In places where we primarily live, throughout the Black Belt South and in some urban centers around the country. And that's where we also see death. And so, these are choices we make. In New York, where I live, Governor Cuomo made choices. It's disgusting to me that he is hailed, along with like the hero of this movement. That man has been cutting Medicare every year, cut $400 million from Medicare in the midst of the pandemic. He refused to even follow de Blasio. I'm no de Blasio fan. We call him de blah blah here, but he refused to close the city when de Blasio said it because they're constantly in pissing contests with one another, excuse my language. And because of that, we probably lost twice the number of people than we needed to lose. So I live here 2 blocks from makeshift morgues near Brooklyn Hospital. I'm serious about this. They mean to kill us. You don't need, and I don't just say that as a conspiracy theory. As a friend of mine, Kenyon Farrow, said, you don't need a conspiracy when you have a good policy. And the policy in this country has said Black people are not worth living.
Thank you for that, Asha. Thank you for that. I'm gonna have Kat, what's your opinion when we say the socially engineer, what is that? Do you agree with Asha, or do you have any add-ons? Like, how would you explain that? Because I just learned a lot in just what Asha just said. So do you have anything? It's like, how would you educate folks on what socially engineer vulnerability actually is? What does that mean?
I mean, I don't have much more to add to the fire that Asha just spit. I will just say that the way that we've been talking about it in terms of in relation to the COVID-19 pandemic is, of course, Black people are getting infected and dying at higher rates because the conditions that society has created for us to live in mandate that, right? The fact that we don't have access to healthy food, the fact that we breathe in the worst air, the fact that we have the least access to being able to exercise and be outside and take care of our bodies, the fact that we are the frontline workers for, nothing an hour. Like Black people, for the most part, a lot of us do not have the privilege to sit at home and collect a paycheck that's directly deposited into our bank account. No, we're driving the buses, we're the store clerks, we're all of these things. And so, of course, right, Black people don't have the healthcare that they need to go get regular checkups from your doctor. And when we're thinking about COVID-19 too, I think it's important to understand that yes, Black people are catching and dying from this virus at higher rates than any other group. But I also and want us to remember the Black people that are dying from conditions that have nothing to do with COVID-19, and they don't have access to healthcare, and now aren't willing to even go to a hospital or an emergency room, right? We also don't have access to information, right? When I look at Oakland and the mess that it has made of communicating to the Black and brown communities about this disease, it's disgusting. It's absolutely disgusting. And we had to raise hell, literal hell, to get city council to even declare a state of emergency as we were watching the numbers pop up exactly where we knew they were going to pop up. We called it weeks before the shit happened. We were like, this is going to hit East Oakland because that's where the majority of Black people that are left in Oakland live. And that's where the conditions are the most deplorable in the entire city. And so, yes, it is socially engineered because had we access to healthy foods and clean air and quality healthcare, if we had access to all those things, our immune systems would take the beating. Not to mention, your immune systems are also targeted by stress, right? Like people have lower in general, not just Black people, people in general, right? If you are stressed out on a daily basis, your immune system is low. You can't be Black and in this country and not be stressed every single day, whether you're worrying about the police killing you, or you're worried about intercommunal violence, or you're worried about paying your bills, or all of the things, being targeted. All of those things, I think all of those things combine to be a powder keg for Black bodies in this moment.
Thank you for that, Kat. So really quick, I wanted to tell you guys, I was looking up some things this morning. It says Black Americans dying of COVID-19 at 3 times the rate of white people. And it's saying that buses and subway workers have been hit hard by the coronavirus, 41 dead and 6,000 either diagnosed with COVID-19 or self-quarantine themselves because they have symptoms. And then it's talking about how you just mentioned, Kat, like, and Asha, like us doing this, like the bus drivers and so forth, people working in the grocery stores, that they feel like they have to pick and choose whether to go provide for themselves or basically provide for themselves or enter into a death trap is how they explain it. So Rosa, I've seen a lot of your Instagram, your social media, and you speak on this as far as like, the essential workers and them putting themselves out there. What's your opinion on like how does the state of our community, especially the Black and brown community, and having to pick and choose whether to take care of themselves and their family or putting themselves in harm's way?
Oh, yeah. I mean, the reason I would do that anyway, but this really hits right in my house because my husband is a custodian. So he is an essential worker. And if we hadn't bought him the PPE, there's still people that he's working with that have been using the same type of masks. And I'm glad I did it. I thought I was a little paranoid, but in early January, a friend of my sister's told my sister, something is coming and you need to prepare. And this person worked at the CDC. And she said, we don't know the name of it, but it's already in the country. And they're saying it's from China, but it's also going to come in from Europe. I think it's important that we trace, like where Asha gave us a history of almost 200 years so succinctly, to even know where this kind of started at, right? Because for those weeks that Trump called it the Chinese virus, there was so much, and still continues to be so much violence against Asian people all over the country, including in so-called progressive New York City. And then, as Asha mentioned, we have a governor who everybody thinks he's the greatest thing since Jesus or God or whatever, I don't know. We know Cuomo's been cutting Medicaid for 10 years, right? And now what he's trying to do is say there's not going to be enough money. They're going to have to reimagine education. Well, what does that mean? You're telling us our kids have to go back to school before they're being tested? I'm not letting my daughter go back to any school until I know everyone's tested, you know? So, and this is like, I don't know, I'll just put it up. I'm sure you've seen it, but this is the equipment my husband has to work in. And today it's 92 degrees. You know what I'm saying? So like, we all have people in our family that are, quote, those essential workers. And to be honest, if it wasn't that we had health care, because he works for the state of New York, he has phenomenal health care, I would have told him probably we got to figure something out. Because every time he's out there, I'm not only stressed, my daughter is very aware politically, very emotionally centered around what's happening. And I can see the toll that it's taking on her and her friends. And she's straight up like, we have no future, the climate and a virus now, you know? So one of the things I'm trying to be more mindful of and checking in, and hope people check in with each other, is the mental health pandemic that we're in. And we're at a very bad point right now with people's mental health. I've talked about my mental health issues, and I would say that all of us who do organizing work at one point have some type of mental health issue, especially those of us that go on these front lines, right? Or deal with the families of people taken by the state and all of that. But to just, and I'll stop after this, to just make the connection, right? When we say Black people, us in the movement, real organizers, know that includes Puerto Ricans and Dominicans and Cubans and Haitians, I mean, and well, you know, Black people all over the world. What we're seeing now is the two epicenters right now is not New York City, it's the Bronx. It's specifically the Soundview community, which has the highest rates of asthma before this, and is one of the poorest congressional districts to this day in the country. So now I have my friend who's a doctor that works at Jacoby Medical Center. He said, what's happening is we're finding people are dead in their homes. Then they're not counting those deaths as COVID deaths. And he was very real when I interviewed him yesterday. And he said, there's a lot of death certificates that are saying it's a heart attack or stroke, and not putting in COVID-19 as why what killed that person, right? In Puerto Rico, we have yet to test more than 10% of our island. Our island went on a very, Puerto Rico was the first place to shut down within a United States territorial area. And people were not happy with the governor at that point. But she shut it down because the cruise industry could do whatever it wants. It let a ship disembark, and Italian people who had the virus came into the island, and two of them were super spreaders. Now what they're saying is that there's a belief that in Puerto Rico, half the island might have the virus, but the government, the United States government, has refused to release any monies or send any tests. So in Puerto Rico, we're also dealing with an elderly population post-Hurricane Maria, because so many young people have left because there's no economic stability or education or that in Puerto Rico. When they do a lot of these racial disparity health or surveys, a lot of times they don't include, quote, Latino or Hispanic people. Like, whoever wants to call themselves that, that's fine. What I do know is that they're not counting what's happening really in all these meat packing plants, how many people have really died. And the majority of those people are either undocumented or an ethnic group of Latino, Latina, Latinx, right? So and it's not a conspiracy theory for us to not have trust in the health system. From the Tuskegee syphilis experiment against Black men to Black mothers in Lincoln Hospital being sterilized without their permission, to in Puerto Rico at one point, 1/3 of our women were sterilized without their consent. So our bodies have been used for medical testing without our knowledge. So there's a reason why a lot of people are like, I'm not trying to go in a hospital unless I have to go, because we know that history. So the distrust is because historically, all of our bodies are something the state continues to either kill, maim, or experiment on. And we have to always think about that.
Absolutely. Thank you for that, Rosa. Dorsey, yesterday, and I believe Kat touched a little bit on it when we were talking about how shelter in place is basically a luxury, right? Like, a lot of people are not afforded that. We want to speak more on that?
I think Asha and Kat really covered it, because like I get to do stuff like shelter in place, and I ain't got to go out and necessarily deliver groceries, drive an Uber, haul people around, and essentially be forced into a situation where I got to toil in order to continue to exist. So sheltering in place for a lot of my homies doesn't exist, because they got to go out and still make a living no matter what. And the little old $1,200 that they sent them is not going to be enough to pay the rent and sustain them for any real periods of time. I got homies right now that are barbers that are sneaking people through the back door so they can actually cut hair and make a living. I know some of the my homegirls are still doing hair in their living room because they need the money. So like, this shelter in place is privilege. It's really a privileged situation. So when I was talking about, and I think about sheltering, even if you are in place, if you're on parole, it don't mean that their police don't get to come in your house and search it anytime they want to. What do shelter in place mean when you put into Volunteers of America in downtown Oakland, and suddenly the pandemic walk into the halfway house, and you mandated to be there? So this whole question of sheltering in place could mean one thing for a privileged group of people, and could be an absolutely different thing for people who are suffering from suffering economic hardship, and Black and brown people in general. We could have a whole different setup. Kat, I was really surprised at the way that they drug about declaring a state of emergency in Oakland when everybody knew that shit was rolling our way. And this is when you have a council that got Black and brown people on it. So like, I want to know, where's the heart at in this shit? Excuse my language.
Wait, but let's be clear, Dorsey. Let's be clear, right? Like, just to add to that, so we have a city council with 3 Black council members on it, right? And we know all skin folk ain't kinfolk, right? We know this. But that's not who brought the resolution. We calling it the Black New Deal. We sent the first letter, signed by over 50 advocates, organizers, clergy, I mean, you name it. We sent the first letter on April something, asked to hear back. Not a peep, from anybody, nobody. Not from the county, not from the city, not from the state, nothing. So we were like, and we had broken down the data, all the stuff. So we sent another one, right? We condensed it. We were like, we demand a response to this in the next 7 days. The only person that responded initially was an Asian ally on the city council, council member Nikki Fortunato Bass, Following her was another Asian sister that's on the council, and following her was a white woman. The Black council members never engaged. They never responded. They never did anything until those other 3 council members agreed to bring a resolution declaring a state of emergency that would focus on testing and all kinds of different stuff, right, that we need in this moment. And then all of a sudden, the Black council members didn't want to talk to us, but they went and got the handkerchief Negroes and brought a counter resolution. And they're not all that. I shouldn't say that because they're probably listening. I'll get in trouble. But people that are more politically, people don't talk like me, right? People don't talk to us. People that are more willing to play with the state in a particular way. And they brought that at the very last minute and then basically bullied the non-Black council members into adopting theirs because they weren't Black. I mean, I'm like, you are playing with our lives. Literally playing with our lives as people are dying for political what? For political what? And I want to say one more thing and then I'll shut up because it's something that I missed. You know, the other reason why we're dying at higher rates, to Asha's point about medical bias, when someone needs a ventilator and it's a white person with health insurance or it's a Black person and got nothing, who do you think is getting that ventilator? Or who is being left to die? You hear these horror stories about Black people going to hospitals and being turned away 3-4 times and then dying in their homes. So that's also really playing out in terms of the way in which this disease is impacting our country, our people. I just wanted to put that additional thing out there.
Oh, thank you.
It's painful, isn't it, as we watch, you know, what just happened with the brother in 9 minutes saying, I can't breathe. And if there's anything that we know about this time, it's that we're being called to breathe. And this pandemic happens at a time that there's also an epidemic of overdose. And what do you need for overdose prevention, right? To save a life, you need ventilators and you need ICUs. And so who do we also think that, you know, if someone's coming in and there's someone whose life has been disrupted, maybe they're using some kind of drug chaotically, you think they're going to pick somebody who's drug using and Black and poor over somebody who's wealthy and white, or middle class and white, or poor and white. They're not. They're playing triage, and they said it. They said it. They said it in Italy. They were very upfront about this. You know, and I mean, you know, I say that, you know, white people lie about stuff a whole lot of times. Governor Cuomo, for example, here said, how could I have known? I wouldn't have known what to do. First of all, every state has a pandemic plan. That's number one. Number two, the New York Times, and again, I'm not holding it up as the bastion, but they did report on this about 500 times before we were shut down. So going back months. So there are times that they lie, but then there are also times they just tell you the truth. They said they were going to triage.
Right. So as a community, you know, when we know better, we do better, especially, you know, I always say, if not us, then who? Then we have to educate ourselves. Like, so I remember when the pandemic first was getting, like, you know, was getting more like news spread and people were talking about it online, and Black people were in assumption, you know, you see all these posts saying, you know, I'm Black and I can't catch it, right? And then studies come out and we see that, you know, Black and Latinos, Black and brown folks were getting hit the hardest, right? And then you see that sometimes in our community, what I personally see as a young woman is that a lot of our folks are still not taking it serious, you know? It's like, they're just still not taking it serious. And we could see that, you know, this weekend on Memorial Day. Like, what can we say to anybody want to jump in this? Why do you think our people sometimes don't take these pandemics seriously?
Let me
Rosa?
Go ahead, Asha.
Go ahead. Okay. I was going to say, I want to maybe reframe that. And I don't want to pathologize us. There has been such mixed messaging, and that's been bipartisan, right? It begins with bipartisan. That's why it's important that we are talking about a Democratic city council in Oakland. The Black people who didn't vote for it at first, I would bet you would say they were progressive, right? We're talking about a Democratic governor who says that he's progressive. We're talking, all of these people. Governor Cuomo told people not to wear masks. I had to beg my parents, my elderly parents, 90 years old, my mother with cancer, my father in remission. When he said, the governor said no, I said, Daddy, he's making a scarcity argument, not a science-based argument. Of course masks can protect you. He doesn't mean you. He's lying. And so when I look at how people respond, right, I look at how the leadership of this country has responded, right? And so it's been very confusing. No one has said what's happening. And so that's one piece of it. But other, psychologically, there is a reaction that people will have when there's not clarity and they want to get some kind of control over their lives. If the United States had done what other countries had done, which is wrap its arms around its people, right? Germany is, I think in the Netherlands, they're paying 90% of people's salaries. Germany, for the people in the gig economy, they're getting $5,000 a month. There are countries that are actually doing things, and these are all countries that have universal health care. There are countries that are actually doing things to ensure their people, to secure them, and so they don't feel like they have to go out and create their own joy, their own security, because people are fighting that too. They're fighting the fear, they're fighting nervousness, anxiety. I'm anxiety ridden, and I live in a much more privileged position than many, many people. But there were so many things that could have been done. This is the United States. This dollar controls economies all over the world, right? We're not on the gold standard and haven't been for 50 years. You can print up money, literally, and put it in people's accounts so they don't have to worry about it. You say, stay home, you're going to be all right. We're going to get you food. We're going to provide the PPE. He could have used the Defense Act to turn all of those factories that make cars, that make anything, right, into things that make PPE. So Rosa, you're not paying for that, for justice, your husband. There's so many things that could have been done, but no other country in the world responded to this by saying, you make a decision over there and you make a decision over there. I think about my family in Chicago, where they do have regulations about masks. They do have regulations about social distancing, and Wisconsin right next door does not. And I watched all them white people come into Chicago on Memorial Day weekend. I watched all those people in Texas hang out. Those were all white people. I live in New York. You should have seen it here on St. Patrick's Day when the warnings were out there. They were in bars. The other day I saw it, right? Because now you can serve drinks on the street. And I don't fight with them because I don't want anybody talking to me. I just had to go and I'm walking my dog. That's it. You right? I had to move out of the way. And so I think that, number one, there has not been a national, science-based, intelligent, calming message, which is what would have helped. Number two, there has not been a national response financially that could have secured people and would have made them less nervous about staying home. Trump got on the air until he was literally pulled off. And for 2 hours every day, nonsense. Shoot Lysol and you have veins or whatever the hell he was talking about. This man is a nut. He's out there, his lies are repeated. People have died because of his lies, taken hydrochloroquine, I can't remember what the name of it is, the malaria drug, right? I mean, it's insane what's happening. And we would do well to remember that there are any number of Democratic, of Black people and leadership who parroted much of this line in the very beginning. Cuomo's the one who said, the fear is worse than the virus. Sounds a lot like the response is worse than the cure. So these are people cut from the same cloth. And they're making ridiculous decisions now. Why is it okay to have 10 people? Why is 10 okay, but 8 isn't? Or 12? It doesn't make any sense. It doesn't make any sense. They caved into the religious lobby in this country to say, oh, you can open up, religious services. Why religious services? So of course someone's going to sue them. And that's why things are opening up now. Not because it makes sense to open it up, because they were trying to avoid a lawsuit because they caved into the religious lobby, right? That's why it's opening up. Not any other reason. You need to shut it down until you control it, until you flatten that curve.
Right. Thank you for that, Asha. I'm sorry. Rose, did you have something to say based off of that really quick?
I did, yeah. Just really quick. I just want to say that the other reason why that they're opening up, I think, is because they figured out that it is Black and brown people that are primarily dying, right? When they thought it was an equal opportunity issue, they're like, no, shut this shit down and let's do it right now. Now they're like, oh, is them? Bet. All right. Open up, make your money. We got you. Sorry, Sister Rosa, I didn't mean to cut you off.
No,
Oh, no, I was going to bring that up because there was an article in the Atlantic that said the federal government responded badly, but when they found out most deaths were Black and brown, they stopped responding at all. You know, and this article traces all of this. But I think there's three things. I think the media narrative around us is incorrect. Every gathering you've seen, for the most part, has been white people, okay? And not 10, 20, but hundreds and hundreds who will now go back into their community and spread it. The narrative of Black people is when you have people like Van Jones and Don Lemon saying, well, we should eat better and we should exercise. And you're like, this is not an individualized problem. Why is it white people get it and should be taken care of? Black people get it, and now we're going to tell Black people everything that they're doing wrong. And we see what happens now with Black men who are jogging, right? Like, but it's particular narrative of certain Black men that have been, our community needs to stop eating chitlins and all this. And you're like, most people I know at this point in my life are vegan and are healthy and still have heart, blood pressure issues because of stress. So I think we have to really interrogate the media in general. And secondly, look, Black and brown men get killed in hoodies. Why would Black and brown men want to put on masks? Because the first weeks of the mask, all we saw were videos of Black men, either white women saying crazy things to them, then being kicked out of stores because they were wearing a mask, right? And then now with this killing, this live killing of George Floyd, you know, we're going to get to now a global pandemic within, or a pandemic in this country right now. Black and brown people are not staying home after this. Right. Or no, should they? We can find a way to protect ourselves and have protests or rallies, because the new stop and frisk is social distance, at least in New York. So they used to stop and frisk us. Now you're not practicing social distance. Oh, you have a mask on, but you don't have it right below your eyes. This is what's happening in, again, New York City, Oakland, and we've seen it. So I think we now have to rely on each other, and we have to also understand that there are mutual aid organizations that we've started all over our communities because we knew no help was coming. And especially in Puerto Rico, they're not surprised. In Puerto Rico, we got abandoned after the hurricane. So there are emerging mutual aid communities, but also cooperatives in this country that are actually thriving because capitalism does not run within that. And lastly, we have to say this is the utter failure of capitalism. That's why they're trying to get us back on the lines. Because if we would stay home, we would stop the entire economy, which should have been what they did. Like Asha said, people should have been paid to stay home.
And you know,
Hey,
Rose,
London, you know, every once in a while when Donald Trump speaks, what goes through my head is messages that I heard on the street. Get your ass out there and get my money.
Yeah, that's right. And
You know, so I hear ultimate pimp talking. And that's what I hear in my head. And I be wondering, am I the only one hearing this message? Get out there and get my money. I don't care if you die.
That's exactly what
You know, and I think that he has the luxury because he's a white person and privileged. And by the way, I think that we'd have been locked down seriously, real seriously, if they hadn't put out the message that Black people were dying. So when they put out the message that Black people dying, when I'm seeing people in the swimming pool and gathering by the hundreds, I think they're doing the damn happy dance. Because I don't think that they take our illness and our health and our lives serious. So I be seeing and hearing different messages when I interpret it from my class background. I be hearing different messages, and and I don't know if other people hear those messages. Right. And what gets me into this fight when they're getting ready to release people out of the county jail, Santa Rita, and COVID-19 that hit. My job is always demand that they free my people. But when they start releasing them in the middle of a pandemic in the worst job market since the damn depression, and they were going to release these people, we gave out vouchers because we wanted to protect the people getting out of jail, but we also wanted to protect the community because we thought we need to put people up for 2 weeks so they could have a chance to at least figure out where they was going and what they were going to do, as opposed to coming out of an environment that was wrecked with COVID-19 and just immediately put them in the middle of the East Oaklands and the other places in the community, because those was Black and brown people that were getting out of those cages. Right. But I don't think that nobody had a plan to actually incorporate this population back into the community in a safe way. But it's hard to be safe if our whole community is living under threat and living up under the pandemic itself. But I just want to say, when I hear Trump, I hear like other stuff, old stuff, injurious stuff, you know?
So really quick though, before we answer to questions, because I want to make sure that we're leaving folks like with like, basically the things that we went over is, you know, just how, you know, this is, you know, been happening forever for, you know, for hundreds of years, and, you know, where we're at in the community and the mental health state and the economy state, and, you know, them not testing Black and brown folks, or these desolate communities are not having access to things that, you know, more privileged white communities may have. What do we tell our people? Like if you're talking to me, a young woman like me, young brother like me, what advice can you give us as far as like, what type of precautions can we take? What should we be listening for? How can we take care of our mental health? Anything that you all have going on, any campaigns, any books, anything that you can recommend and tell folks the next action. Kat, I'll start with you.
So yeah, I want to start by talking about what Rosa touched on in terms of the mutual aid piece, right? That we are providing our own mutual aid, and I want to shout out all of us, and then I also want to shout out Terha Akin Community Ready Corps, who, you know, raised their own money and went to the Black vulnerable communities and dropped off masks and hand sanitizer and worked with the nurse that's in APTP to create a brochure of COVID-19 factor fiction, and making sure that got into the communities. I mean, we have to be our own messengers because they're not going to message, you know, correctly to us or for us. And so, and that's critical, I think, in this moment. I mean, I think all of the, you know, all of the science that we know right now, which I agree with Asha, like the 10 people thing, I don't know where they got that from, but we do know that masks protect you, and we do know that social distancing helps. And we need to be talking to each other. So like in my neighborhood, you know, where I was seeing the brothers and them out, you know, like brother, do you have a mask? Do you need a mask? Sis, you need a mask? I can get you a mask. You know what I mean? You need to wear a mask. This is why I need to wear a mask, right? And having those conversations are really, really important. And sure as shit, you know, as the weeks wore on, they started having masks, right? Or I had CRC come bring them some masks or et cetera. I think the other thing I want people to be really careful about, because yes, we need testing and we need the tracing, but we need tracing that's not going to further criminalize Black and brown people. Because they're using the words tracing and surveillance, and words matter, right? Words matter. We spend all this time fighting against surveillance, and they talking about contact tracing and surveillance. And so I'll just put a general scenario out there. Let's say JoJo just got home, and so he's not supposed to hang out with certain people, right? He gets tested. He's positive for COVID-19, but he did went and see his cousin that he wasn't supposed to see. And then all of a sudden he's back, you know, at Santa Rita with COVID. I mean, those are the kinds of things that I think as a community, we need to be on the lookout for. Like, how are they going to utilize this virus to further criminalize, incarcerate, and terrorize us with the state?
Thank you for that, Kat. Asha?
Thank you. And for everything, Rosa and Dorsey, I always love the way you just make it plain for the people. And Kat just said, you know, I want to say this. Speaking of making it plain, you know, Malcolm X instructed that of all of our studies, history is best qualified to reward our research. And I don't want to make short shrift of the importance of reading, of teaching what we know, to your point, Kat, not just about what we know right now, but what we know is going to protect us in the long haul, because this virus will come and it will go, and other things will come. The true pandemic is white supremacy, and I never want to take my eye off of that. I never want to take my eye off of that, because it it really today is Corona. It could be something else on another day. And until we understand that, and we understand how we can work together, because to Rosa's point, there are examples right now of people pulling together, right? You can go back 15 years and look at what Cuba did during the special period to address people's mental health. When they lived on 15% of their gross national product, people didn't go crazy. There was a reason for that. There were things that were put in place in a society that valued healthcare, right? Because it was a society that where one of the revolutionaries was a doctor. And so that is central to who they are. There are things that we can actually demand. We can actually figure out by studying how not to be self-aggrandizing. Too many activists that we have right now are more interested in being celebrities than they are in being advocates. Too many politicians are only in the game to have their next election won. There are too many ways that we play into this game for our own selfish reasons, even while we speak the language of it being for other people. There are too many poverty pimps. And so there's so many things that we can do. I think that there's a tremendous role that white allies can play, especially in philanthropy, but they have to play the right position. And right now, they're leading oftentimes, right? And what's the strategy going to be? How do you know that? Where's your data? Where's your research? Love is not a logic model. It is not. And so I do not believe that they are playing the right position. There's money actually out there. And all of those philanthropic entities that are out there, those are tax shelters. Those are monies that should have been in the public coffers. And they've privatized those dollars and then said who could get them. You can get a little snatch over here, a little snatch over there. No, we need to be saying something about how those monies are dispersed. There is an easy enough national plan. Ain't nobody staying in no damn hotels. They could convert Airbnbs to safe places for people to come home from prison. They should be allowing people to come home from prison, the elderly, all the things that we know. The people who commit sex crimes, and I'm going to say it right here, people who commit sex crimes and violent crimes are the least likely to recommit those crimes. Those should be some of the first people considered for coming home. And I know that feels controversial. I know it feels uncomfortable. I'm a survivor of sexual violence, but I will tell you this, somebody who did that, they've done 20 years, they're probably not going to do it again. The people who are going to do it again are usually, they're going to be crimes of poverty, right? Stealing, things like that. Right? But it's not going to be somebody who committed a murder. That probably will not happen again. And so all of those people should be considered for early release. If we stopped arresting people today, you could drop the population of people in jails by 54% in 1 week. In 1 week. This is where people are cycling in and out in these petri dishes for the virus, and then coming home. 10 million pass through those jails every year. 10.5 million. Stop it. Stop it. They stopped that man for forgery. Are you kidding me? The entire United States is based on forgery. Are you kidding me? So there's so many things that we can do that, and I just don't want to take my mind off like some of the philosophical and the studying and the learning that we have, because there are examples. There are examples. That National Defense Act could turn all those hotel rooms in Oakland and San Francisco that are not now being used into safe homes, safe shelters by people who do pull together as a community. I know my husband did 27. So I know people in prison pull together, work together, create community. And right now through San Quentin, Lompoc, all these places, they are taking care of each other, because you better believe that the healthcare industry and prisons are not. So I have much more faith in them holding that together, keeping it clean, keeping it sterilized, and making sure everybody's okay, than I do in what we have right now.
Thank you, Asha. Thank you for that. Rosa?
You know, this is a very hard moment for people who are organizers and activists, and I've been encouraging more and my friends to really sit with this for a second, because what I've now seen is, you know, the organizer's DNA is to be amongst the people, and is to be outside and to be in community with people. Now, this is the opposite of what we're supposed to be doing, you know, but I also am very concerned. I see so many of my friends like on Zoom or all this from like 7 a.m. to 10 p.m. I'm very concerned with how nonprofits especially are making people be overproductive, because there's this idea, right? Well, if you're home, you're just home. Of course I could do a Zoom call 9 times in a row, you know, and I'm like, wait a minute, there's unions that fought for this, you know? But what it really is as an organizer, you're like, I have to be working every moment. I think we have to maybe listen to Mother Earth for the moment and say, we might have to pause a little bit. We might have to be more introspective and really go back to the Black radical tradition of intellectualism and understanding what's going to come next. So one simple thing, me and my family, well, now I did, because my daughter and husband haven't eaten meat in years. I was like, that's it. I'm not eating meat anymore. I shouldn't have been eating it. But now there are people who look like anyone in my community literally dying for people to have meat. The way that whole story ran, you would have thought America, there was no food in the country. You're like, it's meat. You shouldn't be having all this production like that anyway. So that's one simple thing I could do. Every day I check in on my neighbors across the street, a brother and a sister that were state workers, and now some of their home healthcare workers aren't coming to visit them, so we check in on them. And third, I thoroughly do a check-in every night with me, my husband, and my daughter on where we are emotionally. Like, I even put a chart that my daughter could say, this is how I'm feeling right now, and we could talk about it. Because they're saying that the next wave of what's going to happen is either people reverting back to alcohol and drug addiction, but also that the rate of suicides will eventually skyrocket. And most people don't know that it is African-American teenage boys and Latina teenage girls that already had some of the highest suicide rates, right? So, and I would recommend the book. It's called The Age of Surveillance Capitalism. It's huge. It's almost 1,000 pages. And she wrote it 2 years ago. Again, it's The Age of Surveillance Capitalism, where she argues in the book, there will be absolutely no, everybody's going to be surveilled at one point or another in ways that we haven't even understood yet. And when Kat talked about that, all this information is going to be data mined, right? And it's going to be used against us. It's going to make it easier for people to, quote, find who they think they're looking for. And lastly, look, here in New York State, unlike California, this governor has not let out not one incarcerated person. And we have over 60 prisons in New York State, juvenile detention and immigrant detention and federal. He has not let one out. And there's an organization called RAP, Releasing Aging People in Prison, where their demand has been 65 people. If you're over 65, you're automatically free. But I think it's interesting what Asha or maybe Dorsey was saying it about, then where do these people go? My brother-in-law's in Sing Sing right now. There's been 5 deaths. One of them were in his cell block, and they let that body decompose for 4 days. He was texting us, and I could tell. I was like, shit, this is going to be bad. This is going to be bad. I then get a call saying one word I used, now they blocked him from hearing from us for 3 weeks. I know how to talk to people who are incarcerated. So I know it was probably them, like, why is now he asking for masks or hand sanitizer? Because in New York State, Governor Cuomo is having incarcerated people make hand sanitizer for all the public, for the high schools education, all public places. The same people that's making the hand sanitizer, first, they can't have hand sanitizer. So the people incarcerated are making it, can't have it because it's contraband. And if anything, if they're making it, why aren't you releasing them? As we have so many people that are nonviolent felons. So New York is very retrograde, and Cuomo's horrible. And I really want people to understand that as he's going to try to run for president, that this man has not let out one person. This is a purposeful genocide that he's looking over when it comes to people incarcerated, especially.
Thank you for that, Rosa. Really quick before I get to Dorsey, if anybody has any questions, please put them now in the chat box. And we're about to go overtime, but we'll try to fit in a few of them. And I want to thank you for that, Rosa, because I think it's really important, like you said, as a community, that we share these things with one another, especially like you said, like, I'm really going to call my mom and sister tonight, to see if they want to do that chart thing and to check in with one another. Because I especially think like for a Black and brown community, one of the things I learned about being incarcerated, I didn't acknowledge it and not acknowledge it until I was incarcerated, was that I was on survival mode, and so was everyone around me. And we didn't understand that we were on survival mode because it was our natural. We've been in survival mode for all the time. So it's like when someone brings it out to you, like I had developed ulcers and pain issues in my stomach, and I didn't know that it was, from stress. And so I think that it's really important to be able to share these like techniques with one another, these tools, so that we can check in with ourselves. Because you're right, as organizers too, it's a nonstop job. It's a nonstop job. And I'm very definitely guilty of like no self-care and going, just keep on going. And, you hear our folks in distress and you feel almost guilty of like I have to be doing something. And so, yeah, thank you for that. Dorsey?
I was just sitting here thinking, out of the union of John and Lula Nunn, they had 7 sons. I'm the only one still left living. 2 of my brothers died from AIDS. 1 of my brothers died from hepatitis C. And I think I came to the office and said, in the event that I die, what I wanted as my eulogy, I want the music to play. Let my work speak for me. What I did was took all unrestricted funds I had in the organization and I started dumping it as hard as I could in the community because people needed help. I've hired an additional 4 people and put them on staff that's in the back room of the Freedom and Movement Center. And what their assignments are is to make masks for the people. Because I think that if it's anything I can tell younger generations, don't look outside of us for the help because it may not be coming. So I think that we need to actually figure out how do we help ourselves because I'm sort of old right now and I'm not gonna be thrashing around in the water expecting people to save me. I'm gonna learn how to fucking swim myself because I think that's what I got to do or else I drown, So we're gonna make masks for our community and have a relationship with our community. And when I went in yesterday, what I started seeing was the masks that we started making for our children. So like that right there doesn't feel good that with all this wealth in the country, I still got to turn around and try to make masks for our kids. So I think they would have a whole different approach if this disease was disproportionately hitting white rich people. They would probably respond in a different way, but they are not. So I think that my existence and my vulnerability is obviously deliberate at this point in history because I can't dismiss it as an accident. I will make masks and I will continue to buy stuff and I will continue to grow.
Dorsey, I wanted to say something. Just love talking with you. But in that film, 12 Years a Slave, there's that scene that just always got to me about the woman who was crying when they took her children, and she was threatened, which was a commonality during slavery to threaten Black women and Black fathers. Black parents when their children were taken or their partners, and we weren't allowed to show emotion, we weren't allowed to grieve. We see that often in the way we act now, to London's earlier point about, why do we behave some of the ways we behave. Our ancestors passed down a whole lot of promise, but also a whole lot of pain. And so I always think, where does that grief go? It doesn't leave. And what does that do to contribute to the stress that Kat talked about and that Rosa talked about? And so one of the things that I do think that we need to do is begin to have some public memorials,
Mm-hmm.
because there are a lot of people
Yeah.
lost, a lot of people lost. I couldn't function for a day when I had passed the makeshift moors. I didn't know anybody in them, but I didn't know I was going to pass them. I was just walking my dog and I was just stunned. I saw them wheeling out a body that could have been someone I knew, right? And I think that there's something, there's something honorable about how we bury our dead. There's something about a rite, RITE. There's something that allows us to know our humanity and how we consign the remains. And the fact that that is disrupted, that so many people are dying alone without the touch of a loved one, right? Is to know that is so hard. And so we're not only suffering from the personal grieving, because at this point, probably all of us have lost someone to COVID-19, but even if we haven't, this collective grieving, you can't escape it. And that on top of what we see in the media from all of these other pieces. There was a doctor who was beat up by police, his mask taken off. He was taking out garbage, trying to clean up around his neighbors, and was attacked by police early on in this, right? Black doctor. A man literally saying for 9 minutes, I can't breathe. A man jogging. That's a lot. It's a lot to know that you live somewhere where they think your life is expendable. And I do think that there has to be a way that we can come together and actually cry, actually feel everything we feel, have a place to put it in however we want to express it without fear of judgment or recrimination.
Yeah.
I need it.
I need it. So that's what one of the purposes of One Community, One Mic is, for us to join together and be able to have these vulnerable, raw, honest conversations and to come up with solutions and ideas. I always say that multiple brains are always better than one. And I really like the idea of thinking about a memorial. And as you're talking, I'm like, I think we're all feeling it right now. It looks like, if I want to speak for everybody, but heavy faces, that feeling that we, a lot of us share. And I just think about, one of our members, our chapter leaders, sometimes things happen, and because it hasn't happened to us, we don't think about, like, there's all these little things within it. So for example, one of our All of Us or None leaders was speaking about how her grandmother passed away in their home in New York. And, but she didn't want to die alone. And she knew that she wasn't going to get adequate self-care. So she stayed home. And, the rest of the family, was at risk of catching it as well. And these are real things that people are facing. And so thank you for that. And please, I see folks asking for anybody's information that's willing to share. Kat, I really look forward to tuning into your show. Please tell the folks really quick, if you can, about how we can tune into your show.
Sure. So I'm on 94.1 if you're in the Bay Area, Monday through Thursday from 7 to 9 a.m. If you want to listen from afar, you can go to kpfa.org. Again, that's 7 to 9 a.m. You can also listen to the archives if you don't want to get up at the crack of dawn with me. I don't blame you. Sometimes I'll be mad that I have to get up at that hour. But yeah, kpfa.org. The show's called Upfront.
Thank you for that. And Rosa, your show, it's tonight, right? And I think, and was it last night too? Or just please tell us how we can tune into your show. And
Yeah, I mean, I started it at the beginning and then I had to deal with my own mental health stuff. But luckily I was really able to start it last week, and we've had on some incredible guests. Everybody can find the episode as soon as it ends on my YouTube channel, or follow me anywhere. But yesterday I had my homie who was trained in Cuba, in the medical program, which is the best in the country, in the world, the Cuban medical program. And now he's the doctor that I've been talking to. And there were so many questions that people had that we're going to have him back. But tonight, in a couple hours, 7 p.m. East Coast time, I will be interviewing the mayor of San Juan, Carmen Cruz, Yulín Cruz, and then one of our sheroes of ever, Dr. Maita Moreno Vega, talking about how do we keep our culture and really look back look as a global community, because the epicenter now is Brazil in the world, and what Bolsonaro's doing to Afro-Brazilians and dragging them straight from their houses. There's been people are talking about this straight killing people in the favelas again, but also the Amazonia community is getting hit really hard. And these are indigenous communities that were already, on the edges of society. And we have to look at that. So yeah, folks can follow me on anything. I'm out there all the time, and suggest or come on my show. I'd love to have you.
Thank you so much. And of course, you can visit us at prisonerswithchildren.org. And want you to become an All of Us or None member. We have over 20 chapters scattered across the United States. And so you can check in with us to see if there's a chapter near you. And if there's not a chapter near you, we challenge you to start your own chapter. We have to, if not us, then who? And so, Paula, can you let us know if we have any questions?
Sure. Thank you, everyone, for your honesty and your vulnerability and speaking from the heart, as is becoming quite a tradition here at One Community, One Mic. You all have a brand new fan base. So for those who are willing to share their contact information, you've definitely sparked a fire with this audience, and definitely people wanting to engage with you. So if you are comfortable, I'll ask the panelists to please share their information in the chat. In terms of questions, a lot of was said about resources, but perhaps, and I know Rosa has been writing in the chat some of the ones that she mentioned, but when it comes to educating ourselves and members of our community, what are your kind of go-to readings on things like policing and criminalization?
Well, there's a new smaller anthology talking about abolishing policing. And, I think all of us that do this work know that there is no reforming of the police ever is going to happen in this country. We have to abolish policing as it currently exists. And that's it. There's a couple, Blood in the Water is a great book. And of course, Asha's writing, the work Kat has been doing, the work Dorsey has been doing. They're all writers as well. And we should really look to folks right around us who are also, I consider them intellectual giants, because they're not only speaking truth to power, they're putting in the theories that we should be adopting that work. So there's a lot of information out there. And also for younger kids, where I go, it's Zinn, like Howard Zinn, ZINN education.org. And it's political history and resistance education from any child from 4 to 18. And it's fabulous. It has worksheets and everything, even coloring, and really speaks to where the anxiety that teenagers are having right now.
Thank you. Asha, you got any great readings? And are you?
It's hard. I'm looking at one of my bookcases right now. I think that if you haven't read the new Jim Crow, you should read that. It's foundational. And I think that, and let me say this, and let me just be a little controversial, because I've been doing a lot of reading on prison abolition and prison reform. Stick with Black people right now. At least I'm saying, don't read white people. I'm so tired of the way that white people are pushing out prison reform in many ways. If I hear one other white person say crime is related to poverty, I'm going to lose my mind. So I think that Carl Hart's book, High Price, allows us to understand what happened during the Reagan epidemic, which is mislabeled the crack epidemic. I think that's so important to understand that. It's important to understand the new Jim Crow, which he lays it out piece by piece. And there's actual solutions that come after it. I think read everything by Malcolm X. I think read everything by Martin Luther King. These were giants. They said it, right? Martin Luther King said community or chaos. He told us that. And he asked us to, really look at these questions. And then I think, read some imaginative verse. There were people who imagined new words. Read everything by Octavia Butler, right? She imagined different worlds. All of this is out here. All of it is out here. And you can get a library card online now for free. So if you don't have money, you can actually, download the books and read them in that way if you have a smartphone, which most of us do now. But there's so much brilliance out there. To Rosa's point, it's hard to, say this one or that one. But these are the people who I lean into, just, giants out here, and people who love us, They're not doing it just because there's money to be made. They do it because they love us, and they couldn't do anything else but for this.
Absolutely. Dorsey, I know you got a gem to drop on us.
Yeah. Not everybody have access to this medium. So all of us AOUON implemented a monthly newspaper. And then we send it in to people because they ain't giving us access to the technology.
Yeah.
So some of us got to stay at home and go old school if we're going to educate people in cages. So I like to thank Paula for actually stepping up to the plate in that regards, because I think that it's important that we also include in the communication strategies, not only those outside the cages, but those still in the box. So we done start writing our own newspaper. So if y'all haven't found it, y'all can look online and see how we working, because we also attach it online. But for people that's locked up, we paying the postage and we sending it into prison. So this month issue is going to be around the 13th Amendment, because some of us are still enslaved and we act like it doesn't matter. And I got to address how do we change and remove out the Constitution in California, the question of involuntary servitude, which is another form of slavery. So I'm gonna be fighting that issue, and we send it on the inside.
Thank you. Kat, thank you so much for joining us. I know you have another call at 1:15, and we greatly appreciate you. Thank you for leaving your information down below. So if anybody wants to get in contact with you, I've been looking at your organization. Great work. Please, folks, visit Kat's. You want to tell did you put your organization's email address? Web address there?
Cat at Justice Teams, but I'm easy to find. I ain't hiding. If you want me, you can find me.
You're definitely not hiding.
Thank you so much for it.
Thank you very much for having me. This was an amazing experience. Asha, I'm such a fangirl. Russell, you already know
I'm a fan of yours. Thank you.
Take care, Kat.
Take care.
And I want to be respectful of everyone's time. We really went over today, but please, if you have a loved one that's currently inside and you think they will want a newspaper, please, I'm sure Paula will put her email address in the chat box, and you can email her so we can get their information and get it sent out. And if you would like a copy yourself, you just send us your email address or visit our website, and we'll make sure that you get a digital copy. And we greatly appreciate everyone's support, and knowledge is power. And I've learned so much, speaking for myself today as a young woman that's just learning, I thank you guys for sharing this information, because I got some reading to do and some self-checking to do. And I want to check in myself, with mental health. Mental health is amongst our community. It's okay to cry. It's okay to feel. I'm still teaching myself that. And I look forward to hearing ideas on how can we, start a memorial and take care of each other and support, it's, if not us, then who?
Can I say something real quick about the memorial? Because Asha is 100%. 6 months after Hurricane Maria happened, there were memorials in every one of our municipalities, and people put the shoes out representing, a pair of shoes represented a person. When that happened, those previous 2 months, the suicide rate of elderly people in Puerto Rico had gone up like 80%. Right. 'Cause Puerto Ricans, we're Catholics, you know, they're obviously suicide is not something that we talk about or that you think about and all these kind of religious stuff. But after that memorial, there were subsequent more public memorials in every municipality, and the mental health issues have gone down a little bit in comparison to where they were. So maybe we can all figure out a way to bring a group of people together that can just do it where they're at right now. You know, I think it's very, very important. The whole world acknowledges they're dead, and this country wants us to forget the dead. So
and
I would love
undocumented, like you said, Rosa. You know, those who go undocumented in life are going to go undocumented in death, and so it is our job. It's our job. I'm still mourning for the people lost whose names we don't know in 9/11. All the workers who were there. And so thank you for that piece of information about Puerto Rico as well. Thank you.
Thank you for educating us. Dorsey, would you like to close us out?
I'll close us out the way I close all meetings. All of us
or none.
All of us
or none.
Thank you, folks. See you guys next week.
Thank you, everybody.
Thank you, Dorsey. Thank you, London. Rosa.
Take care. Love you, girl.
Bye.
Bye.